My name is Dr. T. Barry Levine. I'm the Chief Medical Officer of Able Medical Consulting. And at this year's conference, I had the pleasure of speaking on the metabolic syndrome, criteria, effects versus causes in cardiovascular disease. For me, this has been a journey that has taken place over a number of years and is still ongoing. A great deal of controversy initially was brought to bear by a number of organizations as to whether the metabolic syndrome even existed, because you have such disparate criteria. You have a phenotype, you have lab tests, and you have medical abnormalities such as diabetes and hypertension. So how do you reconcile obesity, hypertension, glucose intolerance, and dyslipidemia as characterized by high triglycerides and low HDL? When you look at it clearly, what propelled metabolic syndrome into the forefront medically and clinically was the fact that it was a handy guide to identifying patients at risk for cardiovascular disease. Delving into the pathophysiology of the situation, however, one clearly sees that they are all connected. You start off with one cause and four effects. By that I mean you start off with visceral fat, which is a repository, among other things, for an inflammatory substrate that triggers both the metabolic and the vascular effects that one sees, that translates to both dyslipidemia, as in hypertriglyceridemia and in low HDL, and also glucose intolerance. These take place at the liver and at the periphery, all due to insulin resistance. Ultimately, the hyperinsulinemia that one sees leads to an enhancement of MAP kinase macrophage and mitogenic factors that cause hypertension. And as such, you get all of the constructs together. What I'd hope to bring forward is that through this construct, we can understand the pathophysiology of the metabolic syndrome and then look at the targets of treatment. And I briefly discussed some of the ongoing trials in that area, as well as some of the proven modalities in treating both hypertension and dyslipidemia that can obviate both the ravages of metabolic syndrome, such as diabetes, hypertension, atherosclerosis. It was an exciting opportunity, and I was grateful for it.